speaker is from Canada. He is the CEO also from the Canadian Association of Medical Radiation Technologists. And the third speaker is my very good friend, Denise Choong from Singapore. She's the Singapore Society of Radiography Vice President and also the counselor for ISRRT. And a very important lady again, she represents the International Society, Donna Newman, our president from the US. And also, we featured a representative from the ISRRT as a panelist today. We have Boniface from Ivory Coast. He's the regional director for Africa. The topic today came from your comment from our first Facebook 2 weeks ago. We have many questions and comments about what do we have or what do we get from our professional organization like the National Society, the International Society, in regards to the response of what you need, you as the member. So in terms of role of radiography professional organization during this COVID-19 pandemic. So in this episode, we will feature three speakers from 3 ISRRT region, the America, Europe, Africa, and Asia, Australasia. And then we will go back to the international organization, which is ISRRT. So let's welcome our first speaker from UK, Richard Irving, the SOR CEO. Richard, you can go now.
It's a pleasure to take part in this program for the ISRRT. Thank you for the invitation. The Society of Radiographers is the professional body and trade union for radiographers and other members of the radiotherapy and diagnostic imaging workforces in the UK. We have around 30,000 members and are celebrating 100 years of our organisation this year. I'll just show you this. There's a picture of where we are and a picture of our Prime Minister. I'm making no comment. For any professional body, understanding the needs and expectations of members at any time is vital if we are to retain impact and be relevant in our role. Hearing the voice of our members in the UK is assisted by our extensive network of elected representatives that are able to bring the views, questions and concerns of members from just about every diagnostic imaging department and radiotherapy department across the UK. In the response to the pandemic, members of the Society of Radiographers looked to their professional body for strong and clear guidance on the use of personal protective equipment. There was a general shortage of PPE within the UK, as I think in many parts of the world. Hospitals were attempting to allocate scarce resources to the most essential services. We found that in too many cases, diagnostic imaging and radiotherapy services were not recognised as being essential or in the front line, so that radiographers were not receiving adequate PPE. Guidance from health authorities was unclear. So we made strong and clear statements of the PPE that is required for radiographers and released this to members so that they were able to use the professional guidance to ensure that services continued only where staff and patients were properly protected. We also teamed up with the Royal College of Radiologists and provided some joint guidance. All of this is available online. It has been important for members to feel that their needs at the front line of healthcare have been taken seriously. Another requirement for members has been for current and accurate information and guidance that the professional body can give. We happen to be in the middle of a process to change our website, expecting to go live with a new site later this year. We decided to use the new technology and platform to bring forward an easily usable, searchable and regularly updated page, especially for COVID-19 information. This is linked directly from the front page of the website, sor.org, and very quickly became a popular resource for members seeking guidance. It is also open to any visitor from anywhere around the world if they go to our website. The content is comprehensive and clear, Again, we used our networks to discover the matters which really matter to members and to their services. Another need of individual members at any time, but all the more so during a major health crisis such as the pandemic, is to feel part of the profession, part of a team, a collective group of people experiencing similar pressures and meeting the challenges together. We asked members to provide short video messages explaining how they were managing the challenges and sharing good practice. These video clips were shared on social media. Our UK Council members joined in with this initiative and contributed inspiring and encouraging messages for members as part of the programme. This is a picture of our president, and I don't intend to play it right now. Have a look on our website and see it. It's been good to see the pride that radiographers are taking in the way that they respond to the extraordinary challenges and demands of working in the pandemic situation. Our communication channels have been used to emphasize personal stories and shared stories. Social media has been a particularly strong area, and we've seen many examples of good practice being shared and encouragement given. Here's a tweet from a radiology department in the northwest of England. Another role for professional bodies is to lead and seek to influence on behalf of members and those who use radiography services. At the start of the emergency, as is so often the case, we felt that the role and contribution of radiographers was being overlooked. Planning for additional emergency capacity in intensive care facilities required advice and data that we were able to provide. We were able to connect influential and expert members with emergency response planning, so that radiographers were at the heart of the national effort to ensure imaging services were planned and equipped. Members of the Society of Radiographers staff took part in high-level response teams and were able to ensure that the professional contribution of radiographers were recognised. As we now look ahead, I think that the lessons that we have learned during the COVID-19 emergency are about communication and influence. Here's some poor communication, 2 signs leading with the same distance to Llantwit Major in Wales. In communication terms, the value of receiving communication from members has been important. Using our networks to hear from members across the UK has enabled our outward communications to be more relevant and responsive. Our new website will be just one part of a renewed strategy for communication and empowerment of members. The influence of the Society of Radiographers has been able to achieve has been largely in partnership with the radiologists and scientific community. We have known the value of team working in the UK for many years, as lots of you will know. Of course, it's great that in the pandemic we've been able to be recognised and heard. But as healthcare realises a new normal, it's important that we continue to work together with other professions to ensure that imaging and radiotherapy services emerge with confidence and ready to shape the way that our specialities are valued and utilised within healthcare as a whole. In the UK, the reprioritisation of health services to meet the COVID-19 challenges had the effect of placing much elective and routine clinical work on hold. Consequently, although busy with the response to the emergency, departments have been able to clear backlogs of imaging reporting. One of the chief concerns amongst diagnostic radiographers as we look ahead is how the increase in clinical demand will be managed with workforce shortages and the need for altered capacity, at least in the medium term, as the need for COVID-19 measures persists. We need to build on the new appreciation of diagnostics as a clinical speciality. We need to work with referrers and commissioners to manage demand before it catches up with us once again. And we need to collaborate with policymakers and health leaders to implement new methods of workforce supply. In radiotherapy, there are similar concerns about managing the return to normal levels of treatment demand alongside necessary new measures to work with the COVID-19 for the foreseeable future. Some of the features of how we manage this will obviously be peculiar to the UK. Our model of a 4-tier career structure for the radiography workforce will be core, as always, to how we approach new ways to ensure adequate workforce supply. Other factors are common to the profession wherever you are. The use of artificial intelligence tools for workload prioritization and clinical decision support will quickly be joined by other exciting capabilities we need as professionals to ensure that these are developed and deployed to maximum effect in ensuring the best patient care. The Society of Radiographers has a reputation for advocacy on behalf of members and patients. We're also known for being prepared to innovate and promote new ways of working where radiographers are central to successful and sustainable service delivery. These attributes have been tested during the pandemic, and we've learned that through excellent communication with members and building our influence, we can face the considerable challenges that lie ahead.
Oh, sorry, I forgot to unmute today. Thank you, Richard, for your presentation. We got a couple of the very, very important keywords from you, including like networking and team working and how to involve the policymakers. And also for those who watch from home, if you have any questions or comment, please leave on the comments box on the website or the Facebook page that you are watching, and we will go back to the panelists and the speaker at the end of the talk from the four speakers. And now I would like to invite the next speaker from Canada, Irving Gold. Irving is the CEO of the Canadian Association of Medical Radiation Technologists, and he will share his own experience and his viewpoint from the CAMRT. Please welcome Irving Gold.
My name is Irving Gold. I'm the CEO of the Canadian Association of Medical Radiation Technologists. Thank you very much for inviting me to this event. It's great to be here. I'm going to start with a little bit of information about Canada. I suspect many of you will know these figures, but I thought for some who don't, it might be an interesting thing for you to know in terms of contextualizing my comments. Canada is indeed the second largest country. We have a population of just shy of 38 million. Around 81% of those live in urban centers. We have a very diverse and multicultural population with a median age of 41.1. Our healthcare system is completely publicly funded, and we have more than 20,000 MRTs in the country. In terms of COVID in Canada, COVID-19, you'll see that we have just over, as of today, just over 8,000 deaths. We had almost 98,000 confirmed cases. And if you look at the graph here, you'll see that things are now declining in a significant way, which is a great relief. But we certainly don't know what the future holds. In Quebec has been one of the hardest hit cities, and 80% of all cases have been in long-term care facilities. This certainly highlights an area that Canada will have to focus on in the future for sure. So the major impacts that COVID-19 has had for our members, MRTs in the country, the first is on education. I'm going to speak to each of these more in depth, but our educational processes have been affected fundamentally. Access to protective equipment, and I know this has been an issue in many countries, and here it has been as well. Human resources clearly has been an issue. One of the things that I think has become very clear has been the lack of recognition of the profession. I don't think this is new since COVID. I think that the pandemic, though, has really underscored the issue and put some of the implications of that into stark relief. And finally, here, and I suspect everywhere, elective procedures and screening, all of that really has gone on hold. And now we're in the process of thinking through how to resume. So in terms of education and training, most of our programs here in Canada have moved to online delivery. Many clinical placements have been disrupted, and for those that have continued, there's been concern about volumes and case variety for training purposes. One of the biggest challenges we had is that we were unable to give our certification exam, which is normally done in physical locations, and that was no longer possible. So we had to pivot quite a bit and managed to put together an online proctoring process. It was the first time we've done it. We were able to iron out some challenges, but I think this may very well be a part of certification in the future. So when the pandemic hit, we really had to think through what our role was going to be. And really what we decided was our first step was to gather evidence, to provide resources for our members. We did create a position statement on equitable access to protective equipment. We have been and will continue to advocate for MRTs, in particular their role as frontline workers. And we're working with government and partner organizations on a variety of topics. In terms of our immediate response, clearly we had to close our office, and we are now fully functional from people's homes. We have roughly 20 staff, and everybody's working from home. It's going actually very well, and I think, again, this is something that associations and many organizations are going to have to consider for the future. We figured out, we quickly identified what the key issues for our members would be. We gathered as much information as possible. We developed a COVID communications plan. I mentioned that we modified our certification exam process, and we began our advocacy work. PPE access, as I said, was one of the first issues we had to tackle. We were getting calls from our members saying they either weren't being given access to appropriate PPE, or when they were being given access, it wasn't being done on an equitable basis among the allied health professionals that were dealing with patients. We put out a survey to gauge the severity of the situation, and we had 3,000 responses in 72 hours. And so for those of you who are familiar with survey response rates, that's a pretty phenomenal representation of the urgency that our members saw the issue representing. We were able to get some editorials in the press, and we issued our position statement. All of these things are available on our website if you're interested. One of the things we also thought was very important was to highlight the important role that MRTs play in our healthcare system, and in particular within the context of the pandemic. So we put together our Proud MRT campaign, created shareable images, and really have been getting these out through social media. There's quite a bit of uptake, and I think MRTs are proud of the Proud MRT campaign. In terms of health human resource issues, what I'll tell you at the moment is that FTE status for MRTs reduced 26% overall. As you'll see, I talk a little bit here about what was most hit, mammography and bone mineral densitometry. Very little change in radiation therapy. And volumes in imaging were reduced by 60%, which is a very significant drop, as you can imagine. The big issue for us was underscoring the fact that MRTs are indeed frontline workers, and when they have not been considered frontline workers, it has had a big implication. Just prior to the pandemic, one of our provincial governments decided to no longer subsidize the cost of continuing professional development for MRTs. And when we asked why, they said, well, we're refocusing our investments in frontline workers. That was a red flag for us. And then when the pandemic hit, we began to see, again, our members being excluded from equitable access to protective equipment in some areas. And the federal government has contributed money to the provinces who administer healthcare service delivery to give healthcare professionals pandemic pay, an increase to their pay. And again, in many jurisdictions, MRTs have been excluded. So for us, it's very important to raise awareness, not only of the profession, but the fact that our members are indeed frontline workers. And finally, we put together an MRT Heroes campaign where we asked members of our MRT community to nominate colleagues that they felt were going above and beyond within the context of the pandemic. And we will be profiling them and congratulating them in a very public way. And again, this is part of promoting the profession and making people realize that MRTs have a very important role to play always, and in particular now within the pandemic. We've also been partnering with other organizations. In this particular case, the Canadian Association of Radiologists pulled together a report here that you'll see about how we're going to resume the clinical services now that we're slowly beginning to do some of the procedures and services that have been backlogged since the beginning of the pandemic. Obviously, resumption is going to take some thought, questions around triaging and safety, patient anxiety. There are a lot of issues that need to be considered. And again, MRTs are being vocal contributors to this discussion, and I think that's also a very good thing for our profession. And that's what I have for now. You're more than welcome to look at our website, which is www.camrt.ca, and all of these resources and documents and a whole lot more are available for you. Thank you. .ca, and all of these resources and documents.
All right, thank you so much, Irving. We got a lot of interesting points from you also. And for the audience from home, if you have any question, again, please leave your message and at the box below the screen or on the side of the screen where you are watching. It depends on the platform that you use. Before going on with the Q&A session, we have another speaker from Asia and Australasia region. We have Denise Choong from Singapore. She is the Vice President of the Singapore Society of Radiographers, and she will be here to share her experience with the COVID-19 pandemic situation in response to her member in her own society. Please welcome Denise Choong.
Good morning, America. Good afternoon, Europe and Africa. And good evening, Asia and Australasia. I'm Denise from Singapore, and I hope that everyone around the world is safe and well. I would like to extend a big thank you to the ISRRT for the invitation to be part of the Facebook Live series, and I'm honored to represent my country and professional society to share with all of you a little more about the Singapore Society of Radiographers and how we have responded to what our members need during the COVID-19 pandemic. I'll begin with a brief introduction about SSR and quickly go over the COVID-19 situation in Singapore. Then we'll look at the needs and challenges faced by our members and tell you about the ways that SSR has responded to these needs. And to round off, we will look at the lessons learned and our future new normal, what it may look like. The SSR is a small society with both radiographer and radiation therapists making up our 200 member strong base. We recently celebrated our 60th Diamond Jubilee in 2018. SSR plays mainly an advocacy role and represents almost 2,000 radiographers and radiation therapists in committees and work groups formed by the Ministry of Health. As a member of these work groups, we provide professional inputs to MOH on matters concerning education, benchmarking, and referencing practice to other countries. SSR was instrumental in initiating the push for radiographer and radiation therapist registration since 2006. And through the team's efforts, today we are a registered profession with Singapore's Allied Health Professions Council Regulatory Board. SSR at its core also strives to be a provider of continuing professional development and is a network platform for practitioners in Singapore. The first case of COVID-19 in Singapore was confirmed in late January, and after a first cluster was discovered in early February, the Disease Outbreak Response Condition, or DORSCON level, was declared at orange alert level. There were small clusters that developed in Singapore between February and March, but the real pickup in positive COVID-19 cases was when a link was found between the foreign worker dormitories and one of the known clusters. You can see from these charts that most of these cases detected from April onwards are actually from the dormitories. To cope with the surge, Singapore created and designated several community care facilities to house these patients, and our radiographers have also been deployed to various facilities to provide imaging support. The beginning of the COVID-19 pandemic was a frantic and uncertain time. Our members were concerned about how they would cope with the surge of patients attending emergency departments, and they feared contracting COVID-19 themselves and the possibility of passing it on to their loved ones at home. With the setup of contingent X-ray suites, our members also needed to know how to modify our radiographic techniques to achieve high-quality diagnostic images comparable to what we would achieve in an ideal setup. There were also manpower concerns from the ground that needed to be addressed at the ministry level with schools and the industry. So to meet these needs, SSR had three main approaches: to motivate and encourage, to share information and experiences, and to represent the profession at MOH discussions. Much like all of you around the world, we have had travel bans and physical social distancing measures in place. Many of us could not travel either to visit family and loved ones or relax and rejuvenate our spirits. Some colleagues even had a leave ban to ensure that all available healthcare staff in the department were present to cope with the influx of patients. This caused a psychological toll on many of us, disappointed that our highly anticipated plans had to be cancelled. To motivate and encourage our colleagues, we posted messages of encouragement and shared anecdotes from our frontline heroes on our Facebook page. We shared relatable stories of skin reactions from repeated and even more frequent hand washing, pressure marks from long hours wearing the N95 masks, but also encouraging scenes and images of radiographers donned in full personal protective equipment or PPE, persevering and pressing on to continue providing high quality care. We also shared links to interviews with fellow colleagues who shared heartwarming messages about their experiences. These are all timely and important reminders that we are not alone in this fight against COVID-19. On the skills front, SSR supported our radiographers with additional resources to update their knowledge by contributing to the development of the collaborative e-learning resource on chest imaging, spearheaded by the ISRRT and the European Federation of Radiographer Societies, the EFRS. This extensive resource was then shared with our radiographers to provide instruction on best practices used internationally and as a learning tool for radiographers who may be slightly out of touch with projectional radiography after spending many years performing other imaging modalities. In the local context, SSR continues to work with various hospital departments to share knowledge and resources nationwide. These include setups of contingent X-ray cubicles, modification of imaging techniques, and resources to overcome language barriers. SSR also promotes webinars and virtual meetings conducted by other institutions and organizations that may be of interest to our radiography community. SSR also looked for ways to continue providing CPD for radiographers and radiation therapists. In the initial stages, the executive committee took some time to address pertinent issues, such as the cancellation of the annual scientific meeting and the postponement of our annual general meeting to avoid cross-institution contact and to comply with physical distancing measures. Our first continuing professional development session began in May after the initial stresses of the COVID-19 outbreak subsided slightly. This was another good avenue for sharing resources and experiences. Representatives from hospital departments came forward to share innovative solutions, such as modified techniques of imaging suspected COVID-19 patients with optimized use of personal protective equipment. New language barriers also arose with the sudden surge in positive and suspected cases originating from the foreign worker dormitories. Between institutions, posters with translated breathing instructions were shared, and through a CPD session, our colleagues shared their solution of recorded audio clips as well to maximize patient compliance to breathing instructions that are very important in obtaining high-quality diagnostic images. This is especially crucial in the early stages of COVID-19 infection, which can manifest as very subtle changes on a chest X-ray. SSR also considered our future radiographers and radiation therapists, the students who were affected by the restrictions due to COVID-19. When Singapore first entered the DORSCON orange alert level, all student placements at the hospitals were halted. So this had been going on since February. But in view of the prolonged alert level, the Ministry of Health's Chief Allied Health Officer called for an online meeting to address this. To ensure that manpower needs are met and that the pipeline of graduating radiographers continues, students' clinical training had to resume. SSR represented the profession, and together with the leaders of other allied health professions, we discussed the approach, conditions, and precautionary measures required for students to be able to return for clinical placements. We prioritized who would return first, emphasized the need for proper infection control training, the exclusion of these students from high-risk areas and cases, as well as health monitoring and reporting. To summarize the lessons learned, we can think of SSR. The first S is for social media. We can leverage SSR social media platforms to share stories, to encourage, motivate, and build resilience in our radiographers and radiation therapists. The second S is to share. We need to share and contribute relevant COVID-19 information, including advisories, clinical techniques, and experiences through teleconferencing webinars and online publications. And R is to represent. We need to continue providing relevant professional inputs to the Ministry of Health to ensure manpower stability and sustainability. So, in our future new normal, we will be challenged to find new ways to connect and collaborate. While we'd still love to have some contact time with our members and colleagues from around the world, it seems that an increased online presence for CPD will be the way to go. From these sessions that we held recently, the attendance rate has more than doubled from our non-virtual meetings. And we are glad that the sessions can reach and benefit more radiographers and radiation therapists, especially those who may be on shift duty. SSR will work on this and perhaps even explore holding social events through teleconferencing platforms as well. So while SSR doesn't have all the answers or resources, it is an aggregator, collaborator, and enabler during crisis. What remains unchanged in this new normal is that SSR will continue to listen and support radiographers and radiation therapists in Singapore and collaborate with our colleagues and friends from all around the world. Take care, everyone. Please stay safe, and I look forward to taking your questions in the Q&A session to follow. Thank you.
All right, thank you so much, Denise. I really like your presentation, especially you link the keyword with SSR, Singapore Society of Radiographers, with social media, share, and represent. We will discuss more about this in the Q&A session. And we will go ahead with the last speaker for today. Well, we have the representative from the international organization, the ISRRT, the International Society of Radiographers and Radiological Technologists. We have our president here today to present about our response to what the members need. Please welcome Madam President Donna Newman.
Good morning, good afternoon, good evening from around the world. I am Donna Newman, your ISRRT president, and I'm here today to talk to you about the ISRRT's role in the COVID-19 pandemic. I'd like to say hello from the Board of Management. These are your leaders from around the world that are serving you during this pandemic. The ISRRT's mission is to improve the delivery of healthcare to people around the world and to promote quality patient care, education, and research, including during this pandemic. Today, I'm going to talk to you about the ISRRT's value to its members during the pandemic and what does the ISRRT Board of Management see of its value to its members. We believe that we're here to collaborate and network with global stakeholders. We believe we should represent your voice globally, help develop standards, elevate patient care for patients, and develop safety standards. We also believe that we should help provide education for our members during this pandemic. So back in February, March, the ISRRT received many requests from its members on how to provide best practice for protective measures during the pandemic. They wanted to know, how do they perform their tests? What precautions should they take? And so the ISRRT Board of Management began to strategize, how can we meet our members' needs? How do we help our member societies? Some member societies had already developed guidance documents on protective measures, including infection control measures, staffing model measures, and procedure measures for protocols, while other member societies did not have the resources to develop these. So the ISRRT decided to develop some resources for its members. At the same time that this was happening, the ISRRT was invited to WHO non-governmental organization meeting with other global stakeholders to talk about the COVID crisis. And we sent Stuart Whitley, our Director of Professional Practice, to represent the ISRRT. We asked him to bring an ask to the WHO. We wanted the WHO to form task groups that would work on strategies for droplet precautions specific to imaging procedures with other global stakeholders. At the same time that this was happening, the ISRRT decided to develop their own guidelines. So I appointed Stuart Whitley to oversee this practice. We asked our member societies to provide expert content for this document. What are the best practices within your country? What are current guidelines that had already been published? And did you have content considerations for all imaging modalities? We also developed a quick reference for mobile radiography, which is one of the most used modalities during the COVID crisis. So you can see here that this document provides great information on staffing models, on what to do for infection prevention, what to do during procedures, how to clean your rooms, in every area of practice. Also, what is exciting to tell you that this document was also used by the WHO and the IAEA during the writing process of their technical development of their guidance documents. The ISRRT also wanted to make it easy for its members to find information relating to the COVID crisis. So they developed a tab that would have the all the information from its member society's content pages. An easy spot for you to go to any member society's COVID page and find information relating to the COVID crisis. ISRRT also wanted to keep its members abreast on the latest information from the WHO, so they developed a tab with links to the WHO's latest advice. ISRRT was asked to serve on this writing committee for a global document that had safety guidelines for professionals during the COVID crisis. And so Stuart Whitley and myself served on the writing committee with the WHO on the development of this global guidance document on chest imaging, specifically in chest radiography, CT, and lung ultrasound. Two writing groups were formed. One was a physician group that actually developed a practical guideline for the appropriate use of medical imaging procedures, starting from asymptomatic patients to the critically ill patients, and when it's appropriate to use different imaging modalities. At the same time, the ISRRT, in collaboration with the WHO and the World Federation of Ultrasound in Medicine and Biology, began to develop an annex that had best practice measures for the frontline staff that were performing these procedures. This book is soon to be released, and we look forward to people downloading it and using it. It is a great opportunity for radiographers and radiologists from around the world to have all the information in one spot on these particular procedures. I was asked also to join a writing group with the IAEA on a technical document for nuclear medicine and COVID-19. You can see that this document is soon to be released too. It was done in cooperation with the European Association of Nuclear Medicine and the World Federation of Nuclear Medicine and Biology and the WHO. And the object of this technical guide was to actually advise nuclear medicine departments on how to adjust their standard operating procedures to allow nuclear medicine diagnostic procedures and therapies to still be performed while protecting staff, patients, and the public, and to help ensure that the spread of the virus didn't happen. So this will soon to be released and will be available for use for all of our member societies. The ISRRT also believed that it was important to educate its members and provide resources for safety education. And so we asked content experts from around the world to help develop this education. And you will find these educational platforms on our e-learning platform at www.isrrt.org. And they're all free to anybody in the world. They can access them and use these resources at any time. We're really excited to let you know that this was just released this week, and this was a webinar on ultrasound, and it provides all the information you need to know about procedures being done in COVID with ultrasound, and also protective measures and how to clean your equipment. Soon to be released in the next 5 days is a radiation therapy webinar talking about best practice and for radiation therapists working during the COVID crisis, beginning with asymptomatic patients, patients under investigations, and patients with COVID that are having radiation therapy treatments. So we're excited about these content experts from Greece that developed this for us, and we think it will be of great use for our members around the world. Also available for the last couple of weeks has been a CT webinar talking about how to have best practice during CT exams for patients during the COVID crisis, and this is available on the e-learning platform. Finally, I'd like to talk about the ISRRT's collaboration with the EFRS and the UK Society on the development of the e-learning resource and mobile radiography. This was a great collaborative effort. It was headed by Professor Peter Haug and Mr. Ken Holmes from the UK. And what they did was they gathered about 40 educators, experts from around the world, and it's also free of charge and anybody can access it. We hope that you take time to use these resources. We think they're of value, and we think that you will find good information on them. We believe the ISRRT plays an essential role in providing best practice resources for its members and in the radiography field. We also believe that we represent your voice at all stakeholder meetings when discussing information relating to the COVID crisis. And we believe by helping provide these resources and the development of these resources, we are actually elevating patient care through these projects. We hope that you see the value of the ISRRT's contribution to resources for its members through the COVID crisis. And thank you for your time. I look forward to hearing the panel discussion.
All right, thank you so much, Donna, for your comprehensive presentation. You see that we have done a lot to our members. So before we move forward to the Q&A session, today we are so happy to have our representative from the ISRRT board. We have Regional Director from Africa, Boniface Yao. Boniface, do you want to say something to the audience from around the world? So happy to have
Hello.
our representative from the ISRRT board. We have regional director from Africa, Boniface.
Okay.
Boniface, do you want to say something to the audience from around the world?
Yeah, good morning, good evening, or good afternoon, our delegates, members, the board members, and dear experts, trainers. Well, the coronavirus disease outbreak continues really to advance in the world, especially in African region, since the first case was reported in February 2020. But what we can see is that the overall number of reported and deaths have been increasing exponentially. And this is why the WHO, these regional officers, are working closely with the countries to find a way. And ISRRT, as the voice of radiography and radiotherapy and nuclear medicine profession worldwide, has built an action plan, which is to address this concern. And the major characteristic is that this contribution is education and setting standards. And these communication we've had, there are key words that we must retain: communication, team working, collaboration, networking, professional awareness, and then motivation and encouragement. To tell you that the COVID pandemic is a challenge for all humanity in this area, and it's a world war, and mankind faces the same enemy, and this enemy is the new coronavirus. And the first battlefield is hospital and the soldiers' medical staff, including radiographers as frontline professionals. And so the ISRRT, its job and its role that has been already underlined by Madam President is to build the bridges and keep the channel of communication open so as to bring the voice of radiography and imaging and therapy profession clear and loud to relevant fora for where decisions are made. And the ISRRT webinars, this is the second one, they have been shaped to afford all the members the opportunity to network and share experiences. So I really invite all the delegates, all the ISRRT members to be active so that this session becomes something really interactive to help us share experiences in order to manage the situation of COVID-19. Thank you.
All right, thank you, Boniface. And we have quite a number of colleagues from Africa watching us live at the moment. Actually, we have everyone from mostly across the world. I saw a lot of comments down here during the broadcast. I got one interesting comment, but since the question or the comment moved back and forth like very quickly, so I lost the question. I kind of still remember what Joseph has asked us. Joseph said that it has been more than a century that our profession has been around, and it's been proved that we are an eye of medicine. I like this word a lot, eye of medicine. But Joseph still wonder, why are we still overlooked? What can we do about that? All right, so this is very tough comment, and I would like Richard to talk about this first, as you are our first speaker.
Okay, thank you very much, Napapong. Why? I think actually part of the time it's because the healthcare system in general doesn't realize the importance of diagnosis and radiation therapy until there is a threat to that. I think that one of the opportunities of the COVID-19 crisis is that it has become much more obvious how important it is that diagnostic imaging in particular is a vital resource. I think we need to make sure that we're standing up alongside our radiologist colleagues in making this point. I think there is an opportunity for a lot of support there if we make the correct alliances, and that's certainly been the case in the UK, so that when we made a noise in the Society of Radiographers about personal protective equipment for radiographers, the Royal College of Radiologists were prepared to join us in that and to make the point that actually radiography is an essential part of healthcare. You won't get the diagnosis without it. It is not appropriate to undervalue radiographers and to say that they can go unprotected into the virus. And because we were able to make this strong statement, and our members were prepared to take that information to their managers and say, look, we're just unable to do this unless you provide the PPE. That has actually raised the profile. I think the challenge now is to make sure that it remains raised, and I think that some joint work around the globe on that would be very valuable.
Oh, all right. Thank you. It's very good point. And in my personal experience, when the COVID pandemic reached Thailand, we didn't really have any document to support our work. For example, the guidelines for infection control, especially for radiography and radiation therapy work. And we really have to thank the UK Society that you have the documentation published on the very first phase of the pandemic. And let me move this question around to Denise, and what do you think about like eye of medicine and why we are overlooked in this kind of situation?
Thank you, Napapong. Well, we are definitely the eye of medicine. I really like that phrase as well. But I think that as we said earlier in the previous episode, I think it was Hakon that mentioned that we need to stand up and be proud to tell people that we are radiographers and radiological technologists and radiation therapists. So in Singapore, we are very fortunate that we have strong support from the ministry, and our radiographers and radiation therapists' voices are heard at various work groups and planning manpower, planning meetings. So when the National Center for Infectious Diseases was designed, the radiographers and radiation therapy community was actually consulted about what our needs were in the planning of the new building. So in Singapore, we've also been gaining more popularity, but also more exposure in the undergraduate courses. So with the establishment of the new schools, the Singapore Institute of Technology, we've actually been represented more at undergraduate school open houses to tell people about, hey, there's this profession of radiography and radiation therapy, and you should definitely look into that. So the word has been going out into the community. I think more and more people know who we are and what we do. And I think we just have to bring that into the culture of saying that when we are actually attending to patients. Like, hi, I'm Denise, I'm your radiographer today, and I'm going to do this procedure for you. Yeah. So I think in Singapore, we're here and people see us. And I think we're very fortunate that way.
That's very great news. Well, from my personal experience, again, when during the first month of the pandemic back in Thailand, our Ministry of Health, they issued the guidelines for infection control for all the profession in the ministry, and our member echoed to me that they were not happy at all. We were called like X-ray technician, something like we are called radiological technologists here, and the ministry put us at the because when they post the document, first is doctors, then nurse, then the laboratory technician, and then like the paramedics, and then bus like the driver and the cleaner. Radiographers are behind the cleaner, and then we got the screaming from all over the places and tell me to deal with the government. Like, well, where we are, how important we are. So we actually team up with the professional society and the professional board and went to discuss with the ministry to correct the terminology and ask them to put back our opinion regarding how we practice and the requirement of the infection control. For example, the PPE, what kind of PPE we need in different scenario like chest X-ray or CT scan, something like that. Well, let's take back to Donna Newman, our president, and see in this kind of response that we would like to give not only to the national member, this is the global member of the profession. What should we do in the future? How would we react, or how would we come up with something to prove that we are this important and not overlooked?
I'm excited to tell you that I do appreciate all the work that's being done in all the countries around the world. I believe that you are our voice, and I believe that change happens from the ground up. And I think that you working within your countries only makes the international stronger. We have in the works of developing a position statement as a frontline worker, and this will be sent out to our members in the next day, which will ask again for our council members who represent you to give feedback so we ensure that the consensus document is written in the manner that you would like. And then I'm excited to tell you that in our third episode of Facebook Live, we'll be discussing the frontline workers specifically and getting feedback from you and seeing if we can even gain more support. So I think as collectively, as a global voice, we'll work with you to make sure we're representing you globally. And then individually, I thank our members for actually representing our members around in their country and with regulatory. And only we can change that status. Only we can begin to change it by interacting with the government and interacting with the regulatory bodies and making sure that we represent ourselves in an appropriate manner. Thank you.
All right, thanks, Donna. And well, we have a little bit of time left, and I would like to take the opportunity back to Richard to talk about how we know that UK society did very well. Your society has been around for centuries. You can be a good example for other society from around the world. I would like you to recap again. How did you do it in terms of responding to your members' need in this time of this coronavirus pandemic? You mentioned about networking, team working, and things like that. Please recap for the audience so that they can get the idea.
Yeah. Okay. So I mean, we do have an interesting structure for the Society of Radiographers in the UK, in that we are a trade union as well as the professional body. This means that we have elected representatives. Any group of members in a department around the country can elect a representative as part of their union representation. And so that is one network we have in place. But we also have a number of advisory boards. Members can apply to join a professional advisory board. So those are we have, according to each modality, we have an advisory board for those. We have a network of managers, networks in radiotherapy, as well as diagnostic imaging. So a number of ways for members to get in touch through those established networks in the society. Obviously, we also hear from individual members by email or social media as they raise questions or concerns about the way that their experience has been affected by the coronavirus. I mean, those. I don't believe that any professional body has to be a trade union to have an effective network, but it did undoubtedly give us a particular advantage in the way that we can hear back from members very quickly through that. Virtually every department in the UK has an elected representative or access to an elected representative. So that's very helpful. And I would encourage other professional bodies to consider how you might have local advocates who are there to hear the views of their colleagues and make sure they're escalated appropriately.
Thank you so much, Richard. Right, kind of run out of time. I would like the speakers and then the panelists just to give the final word to the audience before we move to the conclusion of this episode. Let's have Denise.
Conclusion to this episode. We hope that everybody understands a little bit more about how our societies can play various roles in this fight against COVID-19. We're here to represent you. And anytime that you need something, just say something. You can reach out to us. You know how to reach us on Facebook, on by email, and we will do our best, even though we may not have all the answers, but we can definitely leverage on our friends from around the world as well, who might have the resources that we can then get to you. So till the next time, the next episode, please everybody stay safe and take care.
All right, thank you, Denise. And now it's your turn, Boniface. Boniface, it's your turn now to just leave the message.
Thank you. Thank you, Napapong. Well, I will thank all the speakers. Really very, very rich presentations. And I would like to just to give some information. The online training tools were used for in Africa for the first time. It was the first time my visa, so I was obliged to give my presentation online with Zoom, and that was at the Paris airport. You see, that was the first time. This series that ISRRT webinars that are happening is just to give the information to the African radiographers and even all over the world that it is possible. It shouldn't be a challenge to be, okay, there's the constraints of time, he couldn't come so that we cannot do anything. We can do it because we had it with the Vice President of Europe, Africa, Econ, who gave his lecture from This is wonderful. Everyone should try. I think that's what is being was going on in Africa, being organized there, and this should be for everyone. So I would like everyone to take this as an example. ISRRT is showing you how to train your members, and everyone must follow. Thank you, Madam President, and all the Board of Management.
Thank you, Boniface. And last but not least, I would like Madam President Donna Newman to leave some message to the audience before we close this program today.
I want to thank all the speakers that shared their experiences with our members. You guys are the most valuable part of our organization, and what you have shared with them will ultimately help other organizations that may not be at the same step that you are in the process. We appreciate your willingness to give your expertise and to share your websites with our members and your training with our members so everybody can elevate patient care. And we look forward to having more of these ISRRT Facebook Live episodes in whatever manner that you, our members, are asking for them in. So again, thank you to our speakers and our members. Please let us know what you want. We're here to serve you.
All right. Well, last but not least, is from me. I would like to thank everyone, the speakers and the panelists to make this episode happen. And we're going to have the next episode, as Donna already mentioned, about the frontliners. Are we really frontliners? So if the audience, if you have any comments or any suggestion, you can just put down on the comments box underneath or right beside the screen that you are watching, depending on the platform. And we are here as your professional organization globally to respond to what you need. Thank you very much. Good morning, good afternoon, and good evening, everyone. And please stay safe until we meet next time. Thank you so much. Goodbye.